The purpose of our research was really to examine the feasibility of these different models. And what I mean by feasibility is examining the acceptability of services from the perspective of women who need the services, from providers and administrators, but we also wanted to examine some of the health outcomes that might be the result of offering services in a way that's both trauma-informed and integrated. We interviewed 3 sets of participants, so this included women who needed services, frontline care, so those who were providing care at these facilities, in addition to our community partners who were the administrators for each of these sites. Our findings can be split into 4 separate analyses, and ultimately some of that was to really examine that first purpose, which was to look at that trauma-informed integration piece. So in terms of thinking about these really unique partnerships that exist in London, we simply wanted to provide some evidence in the scientific literature that these approaches are really useful in terms of connecting women to the services that they need, but also helping them to recover. Now, in terms of integration, what we found is that this approach really took place at 3 different levels. So providers themselves had integrated skill sets. For example, the nurse who's also trained to provide trauma-informed care. We also saw integration existing at the facility or agency level. So again, one shelter that also offers counseling, it offers showers and laundry, it offers mental health and physical health. But lastly, that system level integration was really, really important. And I think the most important piece here is for us to be able to educate policymakers about how it is that we can better provide services to women who currently are not necessarily getting the things that they need. And what we did see is that, yes, integration existed at the system level. Unfortunately, we saw that our agencies were doing a lot of the legwork in order to make these collaborative partnerships happen. An interesting finding that we didn't necessarily expect was related to relationship building. And I think one of our administrators put it best when she said that relationship building is not simply a soft skill set, but instead this was a real tool to facilitate women's recovery in addition to helping them to access the services that they need. So ultimately, one of the questions is, what are the implications of this research? And I think most importantly, that has to do with what we want to tell policymakers. And what we believe is that system-wide, at the ministry level, we need to be adopting a trauma-informed model. And this isn't only going to help the women who we interviewed in our study, but instead everyone. Understanding the pervasive impacts of trauma are essential in delivering any kind of care to people.